Hey guys, and welcome back. Well, how are you doing today? Hopefully, you are doing good. All right. Well, today we're going to talk about fibromyalgia and weight gain. And why do you gain weight with fibromyalgia? And some solutions on how not to gain weight. Okay? Well, the first problem is a common problem with fibromyalgia is weight gain. Now, many patients complain that weight gain becomes a major problem once fibromyalgia is established. Now, it is not unusual for a person to put on 25 to 30 pound weight gain in the first year after fibromyalgia is diagnosed. And see, you thought it was just you and you swear you wasn't eating that much. Yeah. Now, various factors are involved in weight gain. Okay? Now, one is because of your metabolism is decreased. Now, various hormone changes can slow down the metabolism in fibromyalgia. Now, studies have shown hormone deficiencies or imbalances of cortisol, thyroid, serotonin, growth hormone in fibromyalgia. Now, insulin and other hormones are probably as affected as well. Now, they describe the hormonal abnormality in fibromyalgia. It's like everything else in fibromyalgia. It's the communication between the brain and the body. Now, closely, the autonomic nerves are the small nerves vital in the coordination of the body's hormone, and thus they play a role in the regulation and delivery of nutrients to our cells. Now, the hypoglycemic roller coaster effect is a good example of the combination of hormonal endocrine imbalances and the autonomic nervous system dysfunction, leading to hypoglycemic symptoms. Now, overall, neuroendocrine abnormalities in fibromyalgia probably interferes with the body's metabolism by decreasing it. And part of the treatment involves replacing or supplementing hormones to help improve your body's metabolism. Yeah. Now, a slower body metabolism means fewer calories are burnt on a daily basis to run the body's machinery. Now, if fewer calories are burned with no change occurring in calories consumption, weight gain will result over time. Now, also, women in their late 30s and 40s often develop fibromyalgia along the same time as menopause coming, and that's a decrease of estrogen. Now, this can further decrease metabolism and increase the potential for weight gain. Now, you hear about hypoglycemia. What is that? Now, that's abnormally low blood sugars. Now, increased sensitivity to insulin will result in too much glucose being removed from the bloodstream and pushed into the muscle. Now, all this extra glucose, which is sugar, is pushed into the muscles, has nowhere to go, as the muscles have very limited ability to store this sugar or glucose. Now, the body is forced to go into a fat storing mode where it converts this extra glucose into fatty tissue. Now, contrary to the popular myth, obesity is a result of eating too much fatty foods. Now, obesity is usually the result of eating too many carbs. Now, a carb-rich diet causes weight gain by converting the extra sugar, glucose, into fat. And if fibromyalgia causes more insulin activity and sensitivity, then the weight gain can be even greater. Yeah. Now, another myth is that most overweight people overeat, and that's not true. Actually, most overweight people do not overeat. They may have a craving for carbs, and the carbs are easily converted to fat. Now, fibromyalgia facilitates this process. A diet modified in protein and lower in carbs may help. Now, you may not know this, but some medicines that you take for your fibromyalgia can cause decreasing metabolism. Now, side effects of medicines used to treat fibromyalgia can cause weight pain. Weight gain by decreasing metabolism, altering hormones, causing fluid retention, and increased appetite. The most common offending medicines are the antidepressants for that depression that you have. Now, medicines such as estrogen and prednisone can also contribute to weight gain. Now, if certain medicines are causing weight gain, they may need to be stopped or adjusted depending on the individual's medical needs. Now, also, this one can cause weight gain as well with fibromyalgia. People with fibromyalgia are likely more inactive than other people due to the pain. And that's the first thing the doctor, which they mean well, but that's the first thing they'll say. You need to exercise. But it's very difficult to exercise when you're hurting. But this is difficult, but this can be the reason you put on extra pounds with fibromyalgia. Now, less calories burned can mean weight gain. Any treatment program in fibromyalgia must include attempts at increasing overall activity. Okay, guys, we're going to stop right there. Don't want to give you too much information in too little time. And this video will have two parts. On my second part, we'll discuss the different ways of losing weight, from diets to pills, medicine, even injections. All right, guys, thank you so much for watching my video. I hope that you will like, share, and subscribe to my channel. And as always, imparted, be blessed, y'all.